I'm Dr. Stan Yeatts, a board-certified obstetrician and gynecologist. I'm going to share something that might surprise you. Did you know that nearly 25% of women trying to conceive have irregular ovulation patterns? As someone who's helped bring over 4,500 babies into this world, I understand how late ovulation can interfere with your goals of pregnancy. A common misunderstanding is that every woman of reproductive age has a perfect 28-day cycle. My experience is the opposite. The vast majority of women rarely have a perfectly predictable 28-day menstrual cycle all of their lives. Every woman's body and life experience is unique. Today, I'm going to share some information from my patient care experience to help you understand your body better and to increase your chances of conception. Now, what's meant by late ovulation? While textbooks might say ovulation occurs around day 14, late ovulation happens after day 21 of your cycle. The most common causes of late ovulation are polycystic ovarian syndrome, or PCOS, which affects about 1 in 10 women, thyroid imbalances, stress, even the pressures of work, health, or pressures to conceive can actually delay ovulation. Significant lifestyle changes such as extreme exercise. Watch for these signs: a delayed positive result on ovulation predictor kits, late appearance of an egg white cervical mucus, temperature shifts suggesting ovulation occurs after day 21 in your cycle. Late ovulation is a complex issue. It may involve several factors such as hormonal imbalances, stress, and lifestyle factors. When we overlook these underlying factors, we may inadvertently miss opportunities to intervene and take steps to improve circumstances. Then we may avoid the persistent cycle of anxiety and discouragement. Women with PCOS are more likely to have hormonal imbalances that affect ovulation. As a result, they may experience irregular periods and ovulation besides other unpleasant symptoms. Thyroid imbalances are another common cause of late ovulation. An underactive thyroid gland called hypothyroidism can lead to ovulation delays. Other related symptoms include fatigue, weight gain, depression, and infrequently there may be no menstrual cycle. An overactive thyroid gland, known as hyperthyroidism, can cause irregular periods, weight loss, and anxiety. Sometimes your heart may feel that it beats too fast. The stress is also reason to disrupt ovulation patterns. When women experience significant stress, their body releases hormones like cortisol, which can delay ovulation. This cause may be difficult to improve. Often stress in life is caused by situations beyond our control. That's why a good support system with loved ones is critical for everyone. Lifestyle changes can also impact ovulation. A significant weight gain or weight loss, poor diet, extreme exercise routines, for example, marathon running, can throw off ovulation patterns. Stress management techniques such as prayer, yoga, meditation, or deep breathing exercises can help alleviate pressures. Then conception is more likely. Now, understanding these factors is helpful to identify late ovulation. Once you recognize the underlying causes, we can address them and take better control of your fertility journey. I'm going to share some common tracking methods. First, let's talk about ovulation predictor kits. These are about 80% accurate in detecting your LH surge, which happens 24 to 36 hours before ovulation. Basal body temperature tracking is another powerful tool. I recommend taking your temperature first thing every morning with a digital thermometer. A slight rise of 0.5 to 1 degree Fahrenheit suggests ovulation has occurred. Proper timing of intercourse is also crucial when it comes to fertilization. Fertilization typically occurs 12 to 24 hours after ovulation. Track your period and ovulation to pinpoint the optimal timing for conception. The egg may last for 24 hours, while the sperm may be viable for up to 5 days. Timing can affect sperm quantity and quality. For the best chance of conception, time intercourse around ovulation as motility and living sperm count decline over time. Here are ideas to help women with late ovulation. Simple lifestyle changes can make a significant difference. Maintain a healthy BMI between 20 to 25. Stress management techniques, balanced nutrition, moderate exercise. For medical assessment, consult your women's health care provider. for a complete history and physical exam. Laboratory studies may be needed to evaluate conditions as PCOS or thyroid disease. Medical treatments may be needed based upon these results. And if infertility is determined, ovulation-inducing medications are possible. For women struggling to conceive, having a solid network of support is crucial. It's important to realize that you don't have to suffer alone. Share with the future dad. Include other loved ones. Some support groups understand your journey since they have been there. I highly recommend trusted resources like Moms in the Making. Their website is listed here. Medical solutions can be a necessity to help improve your success rate. Medications may be needed to help stimulate ovulation, but these drugs are best managed by the guidance of a reproductive health specialist. Through understanding your cycle and making positive changes, you can boost your chances of successful conception. Now, here are 5 points to consider to boost your conception chances. First, track your cycle accurately. Accurate tracking is key to identifying late ovulation. I recommend combining basal body temperature charting with ovulation predictor kits and using modern apps like Mira to stay on top of your process. A reliable tracking system requires consistent effort and attention to detail. And it's important to manage stress. Stress affects nearly 50% of women trying to conceive. Practice stress-reducing techniques I mentioned earlier, like prayer, meditation, yoga, or deep breathing exercises to keep your body and mind in harmony. Develop a self-compassionate disposition toward yourself. Life is tough for everyone. Stress may affect nutritional health, even taking away the benefits of nutrients that our body requires. Stress can negatively impact the immune system, disrupting digestion and so many other things. Stress can cause fatigue and depression or anxiety. Now, lifestyle tweaks matter. Maintain a healthy BMI if you can. Eat a balanced diet rich in omega-3 fatty acids and antioxidants. Engage in moderate exercise like brisk walking, cycling, or swimming for at least 30 minutes a day. Studies suggest that women with a normal BMI on 20 to 25 are more likely to conceive than those who are underweight or overweight. Combine a healthy BMI with a balanced diet and regular exercise. Medical solutions for fertility support may be needed. If you have a diagnosis of a medical problem such as PCOS or thyroid disease, your provider may recommend medical treatment to improve your health and chances to get pregnant. Always keep in mind that you would need professional help. Ovulation may be stimulated by some medications. These hormonal treatments are best managed with the care of a reproductive health specialist. And finally, celebrate success and persevere. Remember, every woman's body is unique. Don't lose hope if you experience setbacks. Every month brings a new opportunity and chance to succeed. Perseverance is key. Be patient with yourself. Carve out time in your schedule for yourself. Take advantage of your support system. Subscribe to our Stork Advisor YouTube channel for regular medical tips. Encourage each other by engaging with our supportive community of women who are on a similar journey. With Stork Advisor, you will have the support and knowledge you need to improve your health journey. Remember, late ovulation doesn't mean you can't conceive. It just means you need to understand your unique situation and have the best chance to succeed. Well, this is Dr. Stan. Thank you for joining me today. See you next time.